Good morning, New Brunswick. Bon matin, le Nouveau-Brunswick.
Good morning, New Brunswickers. I'm the Premier of New Brunswick, and I'm really happy to be with you this morning.
To be here with you this morning for this third live Q&A session of the Holt government. So I say third, but it's the first in this format. So our team has held 2 live Q&As that we streamed through our social channels, and those were live on the spot Q&As where we took the questions from the people who were online at the moment, who were submitting them in the moment, and we had some really great participation in that format. Je pense qu'on a eu
I believe we had 1,000, 1,200, 1,300 people who participated at the last session. But we thought it was always the same people who really quick to ask their questions.
This one. It is an experiment, and I want to thank you for being part of it. What we did this time was we used a technology called Mentimeter that allowed people to go on and submit the question that they wanted to ask, see what questions other people had submitted, vote for the questions they were most interested in being answered, and then I have committed to going through those questions, starting from the most voted on questions and working our way through to the least voted on questions. Alors, c'est la première fois qu'on a...
So it's the first time we've tried this format, this approach to get yourself engaged. And I'll share the numbers of how many people participated in this version of New Brunswick is Asking Questions.
NB Asks, we had 322 people submit questions to the Mentimeter system. They submitted 460 questions total, and that's across, so 54 questions came through the French link, puis 406 questions.
And 406 questions were submitted with the English link, and we've had 6,376 votes on the questions.
6,376 votes on those 460 questions that were submitted. I'm really excited about that level of engagement. Hundreds of people submitting questions, thousands of people voting on the questions that they are most interested in seeing answered here this morning. So j'aimerais commencer par vous remercier.
I'd like to start by thanking you for getting committed in this process with us, because it's clearly the first time that we've tried something like this, and I really appreciate the fact that you participated.
That 6,376 of you participated to at least vote on a question. And now I say that, now some people may have voted multiple times. So I don't know exactly how many unique voters they were. We can probably find that out as well, since this is the first time we're doing it. But that's how we set this up. A little bit of a summary of how it's going to go forward. There were a number of questions that were on the same theme or almost identical questions with just slightly different wording. So we did try to group together the questions that were on the same topic and address those. So some questions will be addressed out of order if they speak to something that another question answered. And I'll do my best to share that with you. Je vais partager cette...
I'm going to share the second most popular question and the 8th question that's the most popular. So we're going to put both together. We're going to answer question 2 and 8 at the same time. And after that, I'm going to continue.
We'll be able to get through 30 questions or so. And we did keep this live right up until the last minute. I believe it was, we cut off our capture of questions and data this morning. At 9 a.m. this morning. So some of these questions are pretty fresh. We haven't had a ton of time to prepare. I don't have scripted answers. I actually just took a little bit of a vacation with my middle daughter, Paige. We got back in last night, so I'm getting back into work mode and refreshing my own understanding of some of these topics because you had some excellent and really specific questions. But I don't want to ramble anymore. I want to dive into what you wanted to ask and wanted to hear answers to. Alors, je vais commencer.
So I'm going to start by sharing the question, the number of votes, and many questions, if it was this theme, and then I'm going to answer, and we're going to go on like that. I hope that I can answer approximately about 30 questions in the hour that we have set aside.
I would love your feedback. If you're somebody who submitted a question, if you voted on questions, if you engaged with Mentimeter or this process, and you have some thoughts on what we could do differently or better in the future, do let me know. The one concern I'm holding in this is that there were 460 questions submitted, and I'm only going to have time to answer about 30 of those. And so that leaves a lot of questions unanswered. And we're thinking about how do we handle that? How do we make sure that people are getting answers to the questions that they'd like in the ways that they'd like? And some people like live and video responses. Some people prefer written responses. Alors, on aimerait bien avoir...
So we'd like to have your ideas, your thoughts, your suggestions, your comments as to how we can improve the system, and to take in your questions and answer the questions, because there are many questions which I will not have time to answer today. So I'm sorry for that reality, that fact, but I'm really assured that with the amount of questions by the hundreds of people and thousands of people who participated, that it is something that is of interest for you, and we'll see how it's going to go at the end of the hour.
On how you found this, if you last the full hour for this live stream, or maybe you just want to see answer to the first and most popular question. So I'm going to get to that one right now and get started after I get a drink of water. Okay, the most popular question by far, and this had, I think, a combined 396 votes because the question was duplicated. It was the first most popular, it was the fourth most popular, and so we added those up, and that meant almost 400 upvotes. And that was around the public health and Horizon plan to reclassify positions from RN positions to LPN positions. I'm going to read a number of questions here because it was question 1, 4, 5, 6, 7, 12, 13, and 17. But actually, I'm going to call out questions 12 and 13 were specifically on the mental health and addictions portion of the change, and the other questions were on the public health one. So I'm going to go through those just quickly. If you're trying to follow along on the Mentimeter website to see which questions we're answering, it opened up with, how will our government protect the health of New Brunswickers by replacing RNs with LPNs in public health, given their scopes of practice and training are not equivalent? The next questions we're asking, we're still waiting to hear the real reason for taking RNs and replacing them with LPNs in public health. The proposal to methodically replace RNs with LPNs is putting the general public at risk. Can you please present the evidence that replacing RNs with LPNs, is safe for the public, and what financial savings are expected, and why did this change not apply to Vitalité? Next one with 114 votes was, LPNs do not have the same status as RNs. Replacing RNs is a step backwards for our healthcare system. You don't see Moncton replacing their RNs. Shame on our government. It's not exactly a question, I guess, but we put it in there given the votes that it was someone who wants to hear a conversation on this topic. What does it mean that there's a pause put in place with Horizon's transformative plan? It seems that it's still going ahead according to recent communications from Horizon to staff. And then the two that were related on mental health and addictions were that RNs and registered social workers from addictions and mental health are feeling as though they're being pushed out of our jobs. Why alienate your needed healthcare workers with workforce adjustments replacing them? And RNs working in addictions and mental health are extremely stressed with the news of pending workforce adjustments and ready to leave nursing altogether. What can you do to help? So I hope you can appreciate why we bundled all of those questions together, and I'm going to take a few moments to talk about what's happening specifically with Horizon and the public health and the addictions and mental health nursing reclassification programs, and there was a reference to Vitalité that I'll try to address, as well as a little bit of where we go from here. I want to start off with this one by recognizing and apologizing to the RNs, the LPNs, the registered social workers who have experienced the stress that was just described there through this process because of how they experienced it, what was communicated to them, how it was communicated to them. This was something that I first heard about, I think it was February of this year, actually through my constituency office. So I'm the MLA responsible for Fredericton South Silverwood, and in my riding is an addictions and mental health unit at the Victoria Health Centre, and it was staff there that were flagging to me and my team that there was a sense that something was happening, but not a knowledge of the details of what was happening. And so it was at that time that we started asking questions to try to figure out what was going on. I'd like to separate the public health program and the addictions and mental health program a little bit, because while the activities feel the same in terms of reclassification of work, I think in my mind they're quite different because of the situation. So on the addictions and mental health side, and I'll talk about this a little more, we need more. We've talked about, as the whole government, the priority that we're placing on mental health care, the need to improve access to mental health care, to put resources into that system, to support the people that are dealing with the tsunami of need because of our population's increased use of drugs and the addictions that they are experiencing, the increased incidence of mental health in our population from the youngest people all the way through. There is a significant need to do more and to do better in addictions and mental health, and to put more resources into that system and to transform how we deliver addictions and mental health supports to the people of New Brunswick. And so that's that process we need to do and do better, but some of the steps forward look very similar to the steps in public health. So on the public health side, it's less about a need for a lot more resources and an inability to address the demand that's out there, but rather a desire to bring public health closer to primary and community health care and integrate it better with some of the changes that we're advancing on the primary care side. And this is something that I'm going to talk about because there are certainly questions about primary care later on. And so we see an opportunity to update how we deliver public health care and integrate it in the kind of collaborative and community care work that's coming forward. And so there is an opportunity to do better in public health as well. But the approach taken felt very similar because nurses felt like they were being communicated by Horizon that all RN positions, or in some cases social work positions in addictions and mental health, RN positions in public health, were going to be replaced by LPNs within a short period of time. And people received that communication, in most cases virtually, and without an opportunity to participate. Our government gave very clear direction to Horizon a number of months ago about the need for the kind of investments and improvements in addictions and mental health that we need to see be done in partnership with the people on the ground delivering the work, because they see it firsthand what the population needs, where the bottlenecks in the service are, where the challenges exist for staff and for the people that they're serving. And so those frontline voices we felt were critical in the participation in the redesign of what stronger, better addictions and mental health look like, and what people are needed to do it, and who's needed where, and how many of them, because we have a lot of work to do to meet the demands in addictions and mental health. On the public health side, similarly, I think the experience was a wholesale shift from RNs to LPNs, and we believe that good public health, kind of like good primary health care, needs a team of people, RNs, LPNs, nurse managers, other folks who are participating in the delivery of public health to New Brunswickers. And so what happened a few weeks ago was we directed Horizon to stop this work because it was clear they weren't moving in the direction that we'd asked them to, engaging the people delivering public health on the front lines, engaging the people delivering addictions and mental health on the front lines, and designing better ways of serving our population with those people that see it firsthand and know it best. And I appreciate the comment that said that it feels like the work is just continuing. We have been in communication with Horizon consistently since we first heard of those meetings on that Wednesday. And I believe that as of today, and actually even I think it was Friday a week ago, so 2 weeks ago Friday, that there has been a stop on that, that Horizon has heard our direction and will not be moving forward with the plan to reclassify RNs to LPNs or social workers to LPNs, and is going to start the process of engaging with the folks on the front lines so that we can all participate and get the benefit of their experiences around how can we deliver the best possible public health care for families, for kids, for patients, so that they can get in and out in an accessible way and get that proactive, preventative care that public health often delivers, and in a way that's integrated with the changes to primary care that we're trying to drive. And then how can we truly resource, invest and support our addictions and mental health units that are dealing with a crisis of demand in a way that is informed by the people who are living that every day. So I want to recognize the experiences the nurses have had over these last number of weeks and months as they had a sense that something was happening and weren't being involved, and commit to you that you will be involved in the design of these improved public health and addictions and mental health services going forward. I'm going to pause here because I realize I've given this entire answer in English and I haven't explained to folks how I was going to handle the multilingual nature of this. And so we received questions through an English link. We received questions through a French link. The majority of the questions we received in each of those were in the language of the link. Not all of them. We received a number of English questions through the French link, maybe a French question or two through the English link. So I'm going to go over to the most popular French questions. I think at maybe the fourth question in a way where the votes aligned, but also recognizing that it's a smaller pool of voters on the Francophone side. And those I will read in French and answer in French. Alors, ça c'est la raison.
So this is the reason why. The last answer I just gave was completely in English. The question was submitted in English. And I hope that the Francophones have access to the link with the interpreters under this format, a different format than the live stream we had formerly, because it gives us access to interpretation resources. So you can receive my comments in the language of your choice if you choose the YouTube in French. You're going to hear the voice of the interpreters and mine.
My voice and the translator's voice, depending on which one you've chosen. And we're still working on getting that single feed so that you can just get both the English and the French from me as I've delivered them. Hopeful that we'll be able to make that happen as a third GNB channel in the future. Alors, je m'excuse pour ne pas présenter.
So I'm sorry for not having presented this information at the beginning, and it's only after that I share the answer about the issues of public health and mental health and dependence and addictions in a change.
On that answer, because this is a shift in how government works, and it's a shift that actually is applying not only to Horizon and the Department of Health, but across all of government. Our government has come in and put in our mandate letters pretty explicitly that we think that the better way to do government is to get out of the building, to get out of the office, to engage with the people experiencing the service on the front lines, the people delivering the government service on the front line, to engage with partners and nonprofits and municipalities, and to build the solution with them. That is not normal government behavior for the past, I don't know how many years. And so I understand that the team has built habits of we follow the direction, we'll let the public know, we'll let staff know once we've decided on the thing that we're going to do. But we firmly believe that we cannot make the best decision on what to do without the engagement of the public and the people on the ground. And that can be challenging because that means that the public, as well as employees, are getting information that isn't finalized. They're hearing what we might do and not what we will do, because we won't decide what we will do until we get the feedback from the people who can respond to what we might do. That is a shift, and it's a tough one. It's a culture change for government and for some of our partners and staff. And so that is the bumpy work that we're trying to drive forward in this process, is to get out of the building, to engage with the New Brunswickers who are receiving the service, who are delivering the service, and to build the better solution with them. And so that is what we are committed to doing, to improve public health services in ways that involve RNs, LPNs, and more, and to improve and strengthen our addictions and mental health services with the critical social workers, RNs, LPNs, and more that are involved in that system as well. And so we are going to be working really closely with Horizon on this. There was a question about Vitalité that I didn't answer. Vitalité had already started the process of introducing LPNs into their public health offices and operations. And so those roles and positions have been introduced, I guess, and transitioning over a period of time. And so as I think folks online know, we have the Vitalité Health System and the Horizon Health System that manage and deliver in different urban and rural environments. And so certainly we've had conversations with Vitalité about public health outcomes and what we want New Brunswickers to experience with that service, as well as what we need New Brunswickers to have access to in terms of addictions and mental health services, and how we can help both health networks have the investment, the people, the processes, and the support they need to make sure New Brunswickers are getting the kind of healthcare services they need, where they need them, when they need them, and from the best possible people to give it to them. So I'm going to stop that one there because that was a lot, but I think that covered 1, 2, 3, 4, 5, 6, 7, 8 of the questions that you submitted. As I mentioned, 1 and 4, 5, 6, 7, 12, 13, and 17. So I'm going to move on to the second most popular question that was submitted, and that was an immigration question. So it had 195 votes as at the moment that we pulled the number. And the question was, why are we increasing the provincial number of refugees and immigrants when New Brunswickers can't get access to jobs, healthcare, and affordable homes? And then there was a second immigration question that was the 8th most popular question with 102 upvotes, that shared that I'm an immigrant myself. I graduated from UNB with AI and computer science. After graduation, I am unable to find jobs in a relevant field. With this situation, why do you want to bring in more immigrants? So you can see both of those questions are essentially asking, why are we increasing the number of immigrants in New Brunswick? So I actually want to back up, because we are not increasing the number of immigrants in New Brunswick, and I actually think that's unfortunate, because we do have a significant need for people in certain sectors of our economy. We used to get 5,500 provincial nominees from the federal government. And so we used to immigrate 5,500 people a year, and we could allocate those across the sectors of the economy that were experiencing the biggest difficulties attracting or filling positions. That got cut in half to 2,750 a number of months ago. I feel like actually that might have gotten cut in half just before we became government. The timing is a little blurry for me, but it was last fall. And that was deeply concerning because we rely on those thousands of people to fill holes, particularly in our healthcare system and particularly in our long-term care part of the healthcare system. And so with that cut in half of immigrants that the province could nominate, we started conversations with the federal government, started negotiating with them, because you may have heard the stories on the news about employers that had workers that they were having to that potentially send home because their work permits now weren't being renewed as a PNP. There were some of those stories in the news at the time, a lot of stress for folks who were hearing that their nomination wasn't going to be renewed, even though they were here, they had found a place, they had a job, they were contributing. And so at the time when we knew we only had 2,750 PNPs, we really focused those on the vacancies that we had in the healthcare system and in the constructions and trade segment of the economy, because as was articulated in the question, we have a housing crisis. We have a shortage of affordable housing for New Brunswickers, and we can't build it fast enough, and we don't have the people that we need to build as much housing as we need. So we prioritized bringing in people with trades, certified trades, experience in the construction sector to help us address the housing crisis. And then there were a couple other segments that were, like I say, employer-driven, that we were trying to support in the economy. You would have heard at the time things like restaurants and hospitality organizations were left off of that PNP list and weren't able to get the provincial nominees that they used to. So as we were talking to the federal government about this, they, as folks may be aware, participate in a refugee program and a receipt of refugees into Canada. Most of those refugees were going to the same couple of points of entry, and a couple provinces had been expressing that they could not handle all of the refugees that they were getting, and so the federal government went out to provinces to ask that provinces help spread the goodwill, I guess, of support for refugees, and offered support for housing and support to bring refugees on. So we worked out with the federal government an agreement that we could get more provincial nominees if we agreed to take 400 refugees into the province, and that we worked out with the business community. We had some leaders from the Conseil Économique, the New Brunswick Business Council, the colleges and others who articulated what supports they could provide to make sure that we were bringing in folks who were going to be able to be housed and who were going to contribute to those critical areas of our economy, whether it be long-term care, working in our special care homes, our nursing homes, our hospitals and healthcare systems, whether it's people working in constructions and building trades and helping our developers and our home builders to get more affordable housing built, and other parts of our economy that drive good paying jobs and drive the kind of GDPs and government revenues that help us pay for healthcare and education and the other services that government deliver. So we haven't gotten back to that 5,500 level of immigration that we used to take in. We're still below that. I think we landed, was it 1,800 more that we got? So we're now at about 4,500 or so out of the previous 5,500 provincial nominees that we can bring in, as well as 400 refugees. Now, I appreciate the sentiment that I don't have a doctor, I can't find access to an apartment that I can afford, and we're bringing more and more people in to join the line for the doctor and to join the marketplace to get access to an affordable apartment. And why is my government making me compete for what feels like a scarce resource? So I want folks to understand that the people that we are prioritizing bringing in are the exact people that are going to build those apartments and deliver the healthcare support that you and your loved ones need, because we struggle with vacancies in our hospitals and in our long-term care sector and in our construction trades. And so it does feel like a bit of a chicken and egg. We need the people who can help us deliver healthcare and build homes in order to have the people that can be your doctor and have the apartment that you can afford to live in. So I get that it feels weird that we're bringing people in when there are long waits to access those services. The people that we are focused on bringing in are the people that are going to help us reduce the waits for those affordable apartments or homes and those healthcare services. I will also say, if anybody follows some of the blogs of economists out there, there is another prediction that we're going to move into a period of population decline that's really going to hammer our economy and make it hard for New Brunswick to produce the kind of jobs that and companies that can pay well and help folks have a livable wage, as well as produce the kind of tax revenue that allows us to pay for healthcare and roads and education. And so we do see population decline coming. We know that we as New Brunswickers are not replacing ourselves with our birth rate, and we need to attract folks from other parts of Canada and from neighboring countries into our province to help strengthen it, to help us grow, and to help us become a more diverse and rich and resilient place to be. And so I want to say clearly that New Brunswick would not be where we are today without the contribution of people who have chosen to come here and make this province their home. I want to recognize and say thank you to the people who have chosen to make this their home. We value you. You are important to this province and to our future. And I want to encourage New Brunswickers to continue to be the welcoming, hospitable, friendly, great neighbors that we have always been, that makes us an attractive place for folks to, whether they're moving back from Alberta or Ontario, whether they're coming here from the US or Europe or Africa or Asia or beyond. This is a great place to live. We need all sorts of different people here to help us be a strong, resilient, diverse society. And so I'm hopeful that we will continue to be a great place and a welcoming place for immigrants and newcomers going forward. I just realized that I didn't quite tackle the question about the graduate from UNB with the AI and computer science degree that was struggling to find a job. We do try to align those student work permits with demands in the workplace, the same way I talked about our prioritization of provincial nominees for healthcare and construction. It's possible that there's a bit of a lag between what is identified when you're coming in to start a 4-year program and what's available in the marketplace 4 years later. But we do have an excellent team with Opportunities New Brunswick and with post-secondary education training and labor. The team is called Working NB. They engage with New Brunswickers to help them find jobs, connect with employers, build the skills they need to succeed in interviews and in the job market. And so I think there still remains demand for computer science and folks with AI backgrounds. If you haven't found that match yet, then I would encourage you to reach out to the folks at Working NB, because I know there are employers in New Brunswick who are looking for those skill sets and hope that we can make that connection for you. How am I doing now? Oh, wow, okay. Just looked at the clock. I have 10:32. So those are 2 immigration questions. The third most popular question was a question about glyphosate. It received 193 votes. There's actually a secondary question that was the 19th most popular with 60 votes. So I'm going to combine those 2 and do one section on glyphosate. The first one read, "Can you stop spraying glyphosate as Quebec did? Have a consultation on it like Quebec did. They're doing fine without it. It may be linked to the mystery disease. We have high rates of chronic illness." And the one that was number 19 said, "I'd like to understand why New Brunswick still allows the spraying of glyphosate, despite the WHO classifying glyphosate as a probable human carcinogen. It hurts every living being breathing in the province." And so there's a couple pieces to this that I'm going to try to address. The first one suggests a consultation on glyphosate like Quebec did. So the government of New Brunswick actually did that a couple years ago through the legislature. There's a committee of the legislature that is the Standing Committee on Climate Change and Environmental Stewardship. That committee tackled the question of glyphosate a couple years ago and produced a report that was unanimously adopted by all 3 parties that were a member of the committee. I think it got, the recommendations had unanimous support from that committee after having heard from witnesses and engaged the public in the topic. And they spent quite a lot of hours and months in the legislature on this subject. So our team has been focused on the recommendations that came out of that report from the Standing Committee on Climate Change and Environmental Stewardship. They had recommendations about buffer zones, about use, and also recommendations about updating data, because Health Canada, that has continued to keep glyphosate on a safe use list, does not have very timely data, nor very New Brunswick-centric data in terms of glyphosate. If you dig in to the data that they base their decisions on, it's going back a lot of years now, and it has a really light sampling in New Brunswick. So we do think that we need to update that, and that's why Minister Lepage, who's the minister responsible for environment, his mandate letter includes a review of pesticide use in the province. That work is ongoing, along with the work on the recommendations from the steering committee. And I also want to then bring in the mysterious illness question, because as public health has been trying to figure out what makes what has been making New Brunswickers sick. That has included the current review that's going on of all of the testing that was done with patients of the mysterious neurological illness, and testing for some environmental factors and others. And some of that testing included glyphosate to see whether there was a higher prevalence of glyphosate in the patients with the mysterious neurological illness. So that data is, I think, in the process of being analyzed by Public Health Canada at the moment. And so we're really interested to see what's coming of that, as well as the work that's going to come from the broader pesticide review that Minister Lepage's team is working on. And I say broader for a reason, because from my understanding, a number of companies and organizations in New Brunswick have moved away from glyphosate to a new compound, a new set of chemicals, but it seems like every time we do that, you might get something a little bit better, but it's still a pesticide and still has chemicals that present risk to New Brunswickers. So that's why Minister Lepage's mandate is not just a review of glyphosate, but a review of pesticide use in New Brunswick. There's other pieces in those mandate letters, so I'm just going to check my notes here, because the completion of some of those studies includes opportunity for more public engagement. The work on the mysterious illness, that is scheduled and has I think there's a website for that gives you the timeline of when that data is going to come out. And then the one other piece, we are looking at Quebec to understand the impact that choice had on industry there. I think that the jury is still out on whether they're doing fine without it, because without it, like I say, there's a substitute chemical that will be used and other processes going forward. So we need updated data. We need New Brunswick-centric data. We need Health Canada to join us in that. We are looking for Public Health Canada's feedback on the analysis of the patients that have been received. We need to deliver on the recommendations that the all-party committee agreed to with the standing committee that will continue to further restrict and control and ensure a safe and responsible use of glyphosate in this province. OK, ceci c'est le moment que je vais changer aux questions.
So now I will move on to the French questions. So just a second. All right. There was a question about education. This was the most popular question with 110 votes. And the second and fourth question were also about education. So I will be talking about education in French in two different ways because of the way the questions were asked. So first question, why are literacy and numeracy are targets in education, but we are not increasing the number of professionals in the schools? For example, the speech-language pathologists, neuropsychologists, and OTs. I really appreciate this question because we decided that literacy and numeracy would be targets on purpose because we want to see an improvement of results in these areas. Our investments in education have a focus on what can we do to improve students' results in those two categories. This is so important and critical. I also think that professional support is a large part of what departments and school districts are doing to make sure that the supports are in place for teachers and for students. This includes speech-language therapists, psychologists, and OTs. We are having a hard time recruiting psychologists. As for speech-language therapists, we have positions in schools. But our focus is absolutely on literacy and numeracy and investing in resources, specialists, and other resources that teachers need to help students improve their results. And this is something that we will be assessing every year. But if we don't see an improvement in the results, then we will change our investment and support program. We want to put our resources and our focus on what will bring results for New Brunswick children. This is work in collaboration with the districts, the department, the schools, and this will be included in the upcoming conversations. The other question about education on the Francophone system is why is the provincial government not able to know the number of children who cannot go to school because of special needs? This question is a question that really bothers me. It's not the right word, but I agree. It is extremely frustrating that we do not know the number of students who have needs and who are not in school for full days, they are just in schools on partial days. It's because we don't have enough support to help these children who are the responsibility of the government. So this is not something that we can keep up with. There is a lot of work that is being done right now, and I would like to thank Mr. Lamrock, because he is the one who brought to light the fact that we are failing these children. There is no mechanism to tell us what the support plans should be for the children, what the impacts are. We need to work with the system, with the departments, and there is no central place with the support access and permissions to see all the information. So this is a serious issue that we need to work on. We are developing the guidelines that will be published in the fall, that the Francophone school districts will be able to implement, so that we get a better understanding of what is happening in schools. So work is underway. I am sorry that this is not something that is already in place. It should be the case. What is the word? It is embarrassing. I'm embarrassed. I'm sorry, I can't find the right word. But this is an excellent question. We should be able to say, yes, we know who these students are. All of them have the services that they need, but that's not the case today, and we are working with the department and the school districts.
For those of you who are following along on Mentimeter, to the English questions. We are now, the next question was the 9th most popular on the list with 95 upvotes, and it's on the subject of healthcare. I'm gonna take a breath. What's being done to ensure New Brunswick residents have timely access to family doctors, medical specialists, and diagnostic equipment? So this one hits home because improving access to healthcare is our team's #1 priority. It was our #1 election promise that we were going to make sure that more New Brunswickers, and is aiming for 100%, which we can't realistically get to in 4 years, but improving access to primary care, particularly, and access to timely care in New Brunswick. So there's a lot that's been done in these last 8 months on that subject. I'm going to give you a few of the highlights and then let you know that this is something that we are focused on every day. The minister, myself, the department, the health authorities, and the system to make sure that we are doing everything possible to improve access to care and to make this a great place for healthcare professionals. We talked about immigration. We're focused on immigrating in healthcare professionals to contribute to this system. But first and foremost, our goal is to transform primary care, the front end of the problem. A lot of our challenges in ER waiting rooms and in hospitals right now come from the fact that too many New Brunswickers don't have access to primary care. They don't have a family doctor or a clinic to go to when they are sick, and that creates problems that just get worse and require acute care. So we have been really committed to delivering on this collaborative community care clinic model of family health teams, a diverse group of professionals, your family doctor, nurse practitioners, we've got pharmacists, physiotherapists, other healthcare providers, nutritionists, counselors involved in making sure that when you go to get primary care for you or a member of your family, you can get the right care from the right person at the right time, and that burden isn't all put on a family doctor who's trying to manage staff and bills and other things when they could be seeing you. So far, we have launched 5 new family health teams in New Brunswick, in Fredericton North, in Lamec, in Tantramar, in Carlton North, and in the Miramichi. Our commitment was to have 10 of those family health teams open this calendar year as we work towards a goal of 30, but really a goal of having every New Brunswicker attached to one of these family health teams by the end of our mandate. So with those 5 new family health teams, that means that thousands of people are coming off of the wait list. I think the number is a little over 4,000 right now that we've been able to invest to increase the capacity of our healthcare providers to serve more New Brunswickers. And then we've also done a couple things like the hybrid OR in Fredericton, making sure that we have the right equipment, like was mentioned in the question, the right support for specialists to make sure that this is an attractive place to come and do either the vascular surgery or what have you that is needed. And we are at this very moment negotiating with the Medical Society on compensation and other pieces related to how we pay our specialists and primary care providers, family doctors in New Brunswick, so that this is an attractive and competitive place that has the practice model that healthcare professionals want, that has the technology support, and a government that is flexible and ready to work with different teams in different parts of this province, so that no matter where you are, you will be attached to a family healthcare team, and you'll be able to get in and get an appointment with that team in 5 days or less. That's what we're working on. That's where our investments of time and money are going to improve New Brunswick as a place that is attractive to healthcare professionals, and thus a place where New Brunswickers are getting access to care. La prochaine, no, in English. Sorry, there was another healthcare question in this bundle, and that was question 10 that received 88 votes. And it was, how does the government plan to improve our healthcare system without a current collective agreement for NBNU nurses? How can we recruit and retain nurses if our compensation is not competitive? So this is a great question. Also something that was very top of mind for us both during the election, was included in our commitments, and then some of the very first actions we took were the $10,000 retention bonus for nurses, and then the $5,000 retention bonus that just came out and is still coming out for some nurses in long-term care, to demonstrate that sign of desire to recognize the work and retain nurses in our system as we negotiate that contract with the NBNU. And those negotiations and conversations have been ongoing since the day that we took government. We've had a number of meetings with the team at the NBNU to get back to the bargaining table to make sure that competitive compensation, the right working conditions, benefits and supports are in place to retain and attract nurses in this province. And so that work is happening really closely with the unions and the RHAs. I'm hopeful that we'll be able to move even more quickly. Some of you may have been participating in the Fair Finish campaign. Those are conversations we're having about retirement age, all of the different pieces that nurses tell us are important for them to continue choosing New Brunswick or be attracted to deliver healthcare services here. So please know that contract for nurses is a priority for us beyond. Just because the retention bonuses have been issued doesn't mean that we think that work is done. We are committed to getting a competitive and fair contract in place as quickly as possible. Next one is, and I'm just conscious of the time, so I'm going to try to talk shorter and more quickly. So this one was about staffing cuts. It was the 11th most popular question on the English side with 84 upvotes. Said it's really disheartening to see the job cuts in the schools and hospitals. While I know that government doesn't directly manage them, how can your government influence their decisions? This is an interesting question because it's certainly one that we've been asking ourselves, right? The relationship with those two parts of government that sit at arm's length, the healthcare system and the education system, where there are boards, district education councils with elected representatives. There are CEOs and superintendents that act with autonomy. And so how does the government that got elected put through our agenda with groups that have autonomy and a different governance structure? So it's something that we've been working on and learning. We did increase investments in both health and education, but as folks who are watching know, we also have budgeted a significant deficit for this year. We don't have as much money as we would like to invest even more in healthcare and education, and even the investments that we're making right now are at the cost of a significant deficit for the province of New Brunswick. But we certainly weren't going to be spending less in those areas. We need to spend more, but the need is growing and outpacing the investments that we're making. So we're trying to make the right choices of where to put those dollars. How do we improve literacy and numeracy? And how do we make the kind of increased investments in education that are going to support teachers to deliver the best possible education to our students and get better academic results? And I believe we can do that more efficiently than we're doing today. It's the same on the healthcare side. We want to see better results in public health, better results in addictions and mental health, more New Brunswickers with access to primary care, and less wait times for an appointment. That doesn't have to mean just more money. It can also mean a reorganization of how we deliver those healthcare services. And so that's why we're looking to make sure that every dollar is getting invested at the front end. It's going to pay off with the measurable results that we presented at the State of the Province in terms of patients that are attached, the amount of people waiting for that care, how long that wait is. So working with the regional health authorities, working with the district education councils, working with those DEC chairs and board chairs and boards and CEOs, there is a push and pull. I think that's appropriate. You know, they're out there to drive their organizations as best as possible. Our job as the people who were elected by New Brunswickers is to put the money and the priority where you tell us is most important. And so we're continuing to both influence, direct, collaborate. As we talked about earlier with that question about public health and addictions and mental health, we are directing those organizations on the how we want them to engage with the people on the front end, the people receiving their services and delivering their services, as we shift to transform how government delivers healthcare and education to get better results as cost effectively as possible. Je vais faire la prochaine question en français.
And I will do the next question in French. It came from the Francophone link. It was the most popular question. It also received 20 votes in English. The question was, you promised legislation on pay equity in the private sector and in the healthcare sector so that everybody is paid fairly. When do you plan on introducing this legislation? Work on pay equity is something that I take to heart. This is something that we debate, that we look at. We've been looking at for years. This work has been done not by the last government, but the government before then. We started work on this question, on this issue again, but we are working on the private sector now, especially for those who are most disadvantaged right now. This work needs a partnership with the public, with the stakeholders who are advancing this file, with a lot of heart, people who are there every day. We will include the private sector, employers, the employers who we want to adopt this practice. This is urgent. It is urgent to make sure that people are paid for their work in a fair way. We are determined to act as fast as possible. We want everybody at the table. We want to move forward together so that this legislation become permanent for the rest of New Brunswick's history. We have conversations and efforts in place, and there will be a progressive implementation for the fall of 2026. So in our work plan, we have things to do this year, and we are looking at the implementation in the fall of next year. Thank you very much for this question. And now I will go back to the Anglophone questions.
Okay, and we're now at property tax. So this was the 14th most popular question with 73 votes. The question was, I think property tax in New Brunswick is really high. Additionally, consumer tax, HST, is also high. While our income is considered low compared to other provinces, do we have any solutions for them? So the cost of living, the burden of the rising cost of living on New Brunswickers is something that we have been talking about, thinking about, and trying to find ways to address for a number of years now, with property tax in particular being one of those. So our government has done two specific things on property taxes. The first one is a freeze on assessments for this calendar year because we have a property tax reform initiative happening. We committed to overhauling the property tax system, to making sure that it is competitive and fair and transparent and easy to understand for New Brunswickers. And most of those changes require legislative changes that we've got to find a way to get into the legislative calendar in a timely fashion, which is why this year we put a pause on your assessments so that they will not increase as a way to hopefully deliver some relief to New Brunswickers. I recognize the comment as well about consumer tax. It's one of the reasons why we took the HST off of your power bills, your electricity bills, and specifically took the 10% provincial tax equivalent off as a rebate on your electricity usage. We did that starting January 1 to try to reduce the cost of power bills for New Brunswickers. It's one of the reasons why we're looking at programs like the school breakfast and school food programs to help families that are struggling with grocery bills and sending their kids to school with full bellies and with lunches. We're going through a process of municipal reform with the Community Funding Act to make sure that municipalities don't have to rely so much on property taxes because they have funding to cover infrastructure and other things. So this is one that, you know, I completely agree and understand why people feel like property tax and consumer taxes and others are going up a lot faster than their incomes are going up. It's why we need to really work on that balance of growing wages in New Brunswick, having an economy that produces good paying jobs that will pay the bills, because that cycle connects, right? The economy that produces those good paying jobs allows us to keep tax rates lower, to keep those bills down. So we've got to keep both of those systems in balance. The 15th most voted question was another healthcare question, this one with 72 votes, asking if there's a shortage of BNs and RNs in the province, why was the majority of the 2025 graduating BNs not offered full-time employment with Horizon? And so this is one that I've had to try to do some digging into to understand. We're told that graduates are typically hired into full-time positions unless they're looking for the specific kind of location or program or unit where the only positions that exist are part-time or temporary or casual positions if they're backfilling somebody that's out. So sometimes those positions are those full-time relief positions that hopefully then can move people from that relief into full-time. There has been some really aggressive hiring happening over this last year. So Horizon tells us they have less than 100 RN vacancies at the moment. There are other vacancies in the system because of, as I mentioned, parental leave, sick leave, training. But as any of those types of positions come with that sort of contract backfill. And so we would love to see every nurse graduating get that offer of employment to fill the positions that, thankfully, the vacancy number is starting to go down. But if there's less than 100, that still means there's more than 0. So we're going to continue to work on making sure that New Brunswickers that complete their nursing education here are getting into our healthcare system in the kind of positions with permanent full-time jobs that they're looking for. Okay, I know now I got like a minute left, and there's a couple here that I really specifically wanted to answer. I'm going to go to the French question that is left. C'est où? Oh, c'était une autre.
It was another question about education, the 6th most popular one with 15 votes. Do you think it's acceptable to shorten the number of school hours for special needs students because there is a lack of budget at the school district level? So this was a surprise to me. I did not know that they were shortening the school hours for students with special needs, and that they were saying that it was because of the budget. The priority is for all students to be able to be in school full-time, and that they get the supports they need in the system. We clearly need to make adjustments in the short term according to the unique needs of the youth. Our goal remains to develop a school system where every student can be there full-time. So I totally agree. Why is this acceptable today that we leave these students without any services? We cannot say that it is because because we don't have money. I believe that it is a question of will.
Through the French link, but was submitted in English, and there was actually a whole group of questions around this. Questions 7, 8, 9, 10, 12, 13, and 14. Each had a mix of 6, 7, 8 votes on them combined, but all related to the mine project in Heron Bay or in Dalhousie. Questions related to what's happening with the project, why is the government supporting it, the threat to vulnerable populations given the location, the instance or the risk that the silica presents, the dust that is proposed, and this is proposed in a location that is close to children. And so from my understanding, and this is something that we're monitoring, the government has not. We don't yet have a role to play in this because nothing has come to the provincial government. We had the proponent has not approached us, has not submitted an EIA. There is not a mechanism for us to stop something that hasn't crossed the threshold of government doors yet. We recognize that this is, and I think I've said before, I have a lot of questions about this project. We hear the concerns of the residents who have been articulating it consistently. We've seen the challenge that this has caused for the municipality, for the councillors and the mayor as they work through this with a population that has a lot of concerns about this project, and there are a lot of unknowns. And so as far as I'm concerned, we have questions. We have not seen a project cross the provincial government's door, so it certainly has not been approved by the provincial government. It is not supported by the provincial government. It is something that we understand is being explored currently at a municipal, local level with a proponent, but that nothing has come to us yet for an EIA. And if it does, then our team here will go through the robust process that we follow to look at environmental impact, locations, dust, risk to local neighborhoods, to kids, to schools, and all the things that we do through the EIA process. And we want to continue to encourage the company to have those community conversations, to make information available, the municipality to bring people together to figure out what this is, what it might be, the location. There's so many questions here, but government is not yet in a position to even ask those questions yet because the project hasn't crossed and come in to the provincial level yet. Je vais retourner aux questions.
We'll go back to the English questions.
and I did not get through the 30 questions that I had been hoping. There were a couple questions on taxes. The next one I think it got a lot of votes at 68 votes, but it said that we campaigned on a cut to the HST of 2%, and when would we follow through with that campaign promise? So that was a campaign promise that wasn't not from us or our team. That was the other team that put forward a commitment to take, I think it's $250 million in HST revenues out of the government coffers. What we did do instead, as I've already mentioned, was the 10% reduction off of power bills, the 3% rent cap for folks, taking the HST off of multi-unit bills to try to address the housing crisis, the property tax assessment freeze and overhaul, as well as the school food programs that are designed to try to help families that are struggling with those costs. But that wasn't a promise that we made, and so not a promise that we've broken. I realize that where you draw the line on these things is a tough one, and so I think that's 16, maybe about 20 or so questions that I've gotten through. I'm sorry that it couldn't be more, and that I know I tend to give a lot of information in these answers, and I want to make sure that you are getting the full picture when you ask questions like these, as opposed to a sentence or a snippet. And so that means that we've gotten to maybe less than I had hoped. And we're gonna continue to look into this and see what is the best way to make sure that the burning questions that New Brunswickers have, that we're aware of them, that we're addressing them. Je vais vous remercier pour votre temps.
I'd like to thank you for your time. I'd like to thank you for your time today, for your votes, for your questions, and for your attention, and for your heart, the belief in New Brunswick, to the fact that you're taking the time to ask questions in support of our nurses, of our students, of vulnerable people, and people who have problems with the cost of living and health, the immigration system.
New Brunswickers who care enough about our province and how it's doing, and how our healthcare system is doing, and how we're supporting students and nurses and others, and looking out for public health and other things, that you took the time to go and cast 6,000 votes for these questions, to enter 460 questions, to spend maybe an hour or 56 minutes with me this morning hearing these answers, and thinking about what more questions that you have for government. I'm committed to continuing to create the opportunities where we can engage face-to-face, video, emails with the media and others, so that you can get your questions answered from myself, from our amazing team of ministers and MLAs. À chaque opportunité, on va...
At each opportunity, we want to share the work that we're doing, and I'm going to repeat that it is work that is changing. It's not work where decisions are made here and we share the decisions, and after that we do the work, maybe of consultation or to try to improve something that has been done already.
How government does things by engaging transparently before decisions get made with the public, with the people in community who have the issues, and to work through solutions with them before we finalize decisions. And so that shift is going to take time. You can't change culture or habits overnight. It's something we're working on. I really appreciate that you're here participating and engaging with us in the work. And I'm going to assume it's because you care deeply for New Brunswick, as do I. So thank you very much, New Brunswickers, for being here. Merci beaucoup pour votre temps.
Thank you very much.
And we will take it away and let you know what the next version of an engagement opportunity, an NB Asks, the live Q&A, is going to look like as we work to be the most accessible and transparent and engaging government that this province has seen, in the hopes of better understanding your needs and serving you better. Merci beaucoup. Bye.
Thank you. Bye-bye.